Good afternoon, everyone, and welcome to our webinar today. I'm Tom Glinsky, Chief Inspector with the Board of Pharmacy. Today, our webinar is on the upcoming Missouri State PDMP program, and with me today is Dean Linneman. He is the Executive Director of the Missouri Joint Oversight Task Force for PDM. I guess it's just Prescription Drug Monitoring is the official title. Just give you some information. In other states, you see the PDMP run by the Board of Pharmacy or maybe the Department of Health. In Missouri, it is set up that it's being operated at the Office of Administration. So Dean works out of the Office of Administration. If you haven't been on in one of our webinars before, I'll just go over a few things. You are in listen-only mode. If you have any trouble with the audio, computer audio, there is an option to choose the phone call, and it gives you information there on your toolbar on how to call in if you need to. This has been approved for 1 hour of pharmacy continuing education. You cannot share a computer to get the CE. You must be signed in to go to webinar under your own username. You will not be given credit if you're just listening via the telephone without logging in. I'll give more instructions at the end of the webinar on how to obtain CE. Just a reminder that CE credit is not submitted to the CPE monitor, so make sure you save your certificates. We'll email you. And don't assume that another state board of pharmacy will accept the CE for their renewal. Handouts for today's program, if you'd like them, you can get them in 2 places. You can go to the board's website. The homepage has been updated since the last webinar. There's now, it looks a little different. There's a box now that says upcoming events. If you click that, it'll take you to a document that has a link to the webinars. On our webinars, on our web page, if you go to publication and resources and go to videos, you'll see a link that says webinar handouts, and we are now posting all webinar handouts there, so you can get any from 2023 on there at that site. On the go to webinar toolbar, you can also find the handouts. If you go down to the handouts tab, there'll be a PDF of today's handouts. We do record our webinars, and you'll find them on the board's website. It can take up to 15 days before they actually get posted, though. We will have time for questions at the end of the program today. If you'd like to submit a question to us, go to your toolbar and you can type it in and hit send, and we'll try to answer those at the end. So now I'm going to turn it over to Dean.
Okay, thanks, Tom. Appreciate you guys having me today, and I do appreciate all the questions that were submitted before the webinar, so we can try to get an idea on where everyone's at with the PDMP, and hopefully I'll be able to provide information that'll be beneficial to everyone as we move closer to the statewide Missouri PDMP. So the Missouri PDMP statute was passed signed in August of 2021. It was Senate Bill 63. The sponsor for that legislation was Senator Holly Rader. And the Joint Task Force, the Joint Oversight Task Force for Prescription Drug Monitoring, is a component of that legislation. And the Joint Task Force was put together initially in December of 2021. And basically the main expectation for the task force is to review and supervise the collection and use of patient dispensation information in the state of Missouri for all Schedule 2, 3, and 4 controlled substance prescriptions. The task force is made up of 6 individuals. Those 6 individuals all represent or are all existing members of current boards. 2 members come from the Board of Pharmacy, 2 members come from the Board of Healing Arts, 1 member from the Dental Board, and 1 member from the Board of Nursing. The Board of Pharmacy representatives are Doug Lang and Christian Tadris. They may be on the call today, I'm not quite sure. The 2 representatives from the Board of Healing Arts are Naveed Razak and Mark Taramino. The Board of Nursing representative is Julie Miller, and the Dental Board representative on the Joint Task Force is Bill Kane. All these individuals will serve a 4-year term on the task force. Give you a little idea on the timeline for the PDMP. It's been discussed for years, I'm aware, and took quite a while to get that legislation passed, but we're happy it finally was passed. Like I mentioned, the task force was put together in December of 21. The task force hired me. I started in April of 2022 and started working at that point on the RFP, request for proposal for bids for the statewide program. The bid went out in October of 22, and we received 2 bids for the statewide PDMP. One was from Bamboo Health, and the second bid was received from a company named Logicoi. Bamboo Health ultimately received the award. They were awarded the project and started working on that in January of 23. Logicoi, the other bidder, may not be as familiar a name as Bamboo. Bamboo does, I think, 44 other states across the country, has some either runs the entire PDMP or major contributor to their PDMP in their states. Logicoi currently runs and participates in, I believe, the Nebraska, Kentucky, and Illinois state PDMP. So for some of you who may be operating on the St. Louis side of the state, you may be familiar with Logicoi if you see patients over in the Illinois side. Implementation began this year in February. We had a little bit of a road bump. As you're aware, the St. Louis County PDMP has been in operation prior to the statewide PDMP. They began in 2017, and we're very appreciative that they were able to get up and running and to provide that information to providers for as long as they have. In February, it was determined by St. Louis County's legal staff that they did not have the authority to share information with the state of Missouri. The statute in 195.600 allows for the state of Missouri to enter into a sharing agreement with any PDMP operating in the state. And St. Louis County being that PDMP, we opted to do that. We've been working with St. Louis County and have just recently got everything squared away to where when we go active on December 13th, we will be able to receive information from St. Louis County's PDMP and be able to basically start the statewide PDMP fully loaded. What is included in that information, and this is, we believe, a benefit for all providers, is historic information from the last 2 years from all of the county information that's been submitted to the St. Louis County PDMP. So we'll be going back, receiving 2 years of information from all of the current participants in the St. Louis County PDMP. The other bonus is that once reviewed and verified that all the users, that's the registered users and their delegates for the St. Louis County PDMP, will also, their passwords and login information will also pass over to the Missouri statewide system. A big thing on that is there are differences between the statewide PDMP statute and the ordinance that was passed by the counties in St. Louis County. So there are going to be some limitations as to access. I'll talk a little bit more about that as we go on through the presentation. Another thing for all of this to work, for the transition over to the statewide PDMP and the transfer agreement to fully work, St. Louis County required the individual county participants to allow St. Louis County to share their data with the state PDMP. So we are in the process now of reaching out to all of those counties who signed an ordinance or who require an order to be made so that they can send their information, allow St. Louis County to transfer their individual counties' information to the statewide system. That's moving along fairly well, and that also is something that we're hoping to have done well before we get to that go live date of December 13th. If for some reason a county jurisdiction decides that they do not want St. Louis County to share the information with the state system, Bamboo will be able to, in their system, filter out all that historic PDMP information, dispensation information, so that it will not be viewable in the statewide system when we go active. Another thing, another concern is if a county decides not to share their data, the providers, practitioners in that county will also be required to re-register with the system. The task force really wanted to avoid this, and that's why we thought the sharing agreement was so beneficial. We want physicians, dentists, prescribers, nurses, we want all those users of the system to be able to see the same data they were seeing on December 12th. We want them to be able to see that same data on December 13th. We don't want a provider to look for information on Jane Doe that was there yesterday, but today when I check, it's not there. So it's really important. If there's any possibility that you could just ask a question possibly with your county commissioners or your local public health agency in the counties you live to ensure that they've agreed or going to agree to allow that information to be shared with the state of Missouri, please do so. We are down to about 2 weeks out, and we have just over about half of the participants in the St. Louis County system, St. Louis County PDMP, that have agreed to share. A lot of the processes are taking place. It just takes a little bit of time to get through all those political processes in those jurisdictions. Let's see. One thing I also want to talk about with the access piece a little bit, we received a lot of questions through emails already. Medical assistants will be allowed to access the system. I believe there was some information that went out talking about unlicensed individuals that would be removed, would no longer have access to in the Missouri statewide PDMP. From St. Louis County sent that information out. It's a little misleading, but there's a rule that's been promulgated. That rule is 1 CSR 60-1.010, and that's the registration rule for the Missouri PDMP. That rule allows medical assistants to be a delegate in the system. So we still have the registered users and we have delegates. So there's been a lot of questions about that, but delegates are listed, and I will, again, they're listed in the rule. The registered users, prescribers are also listed in that rule, and we'll go through that a little more specifically later on. Let's see. And another thing, when that was agreed to on the sharing agreement between the state and St. Louis County, the county will be transitioning 2 years of information into the state system. So the state, once we start up and running, will be able to maintain dispensation information for 3 years. But at this initial transition, we will have 2 years of information transferred to us from the St. Louis County system. And again, the system go live date for the statewide PDMP is December 13th. And at that time, when we go live, the St. Louis County PDMP will cease to operate. Okay, getting into more of the PDMP specifics, the controlled substances, Schedule 2, 3, or 4 controlled substances are what is required to be submitted to the state of Missouri. The task force, the Joint Oversight Task Force, is authorized to supervise the collection and use of patient dispensation information for prescribed Schedule 2, 3, or 4 controlled substances as submitted by dispensers in this state. And that's a key phrase. In the statute, about 4 or 5 times the language "in this state" is used. So the authors of this legislation, we're really focusing in on the state of Missouri and dispensers in the state of Missouri. So only dispensers in this state are required to submit. There's no requirement for out-of-state pharmacies to submit dispensation information to the Missouri PDMP. We've had several calls and questions on this so far, and that's the information we want to get out there. As an example, we had a pharmacy in Denver that ships prescriptions to Missouri. They are not in this state, so there's no reason for them to submit data to, there's no requirement for them to submit data to the Missouri PDMP. There was also a pharmacy through the University of Chicago had asked a very similar question. Another question about the state law for the PDMP, Missouri statewide PDMP, is concerning veterans, or not veterans, I'm sorry, veterinarians. Vets are exempt from reporting. There's specific language in the statute that refers to Chapter 340 of the revised statutes of the state of Missouri, and basically exempts veterinarians from participating. We received a question from a veterinarian pharmacy asking if, okay, well, the veterinarians don't have to report, but do veterinarian pharmacies need to report? The basic answer there is no. The definition used in the statute 195-600 for patient would exclude pets and livestock. So they're also exempt from reporting. I mentioned earlier that the statewide PDMP will maintain information for a period of 3 years. That's again statutory. We will only be receiving 2 years of information from St. Louis County when we go live, but 3 years is the length of time that it will remain visible in the statewide PDMP. A lot of questions about who can see this information, who cannot see this information, and those types of things. The easiest way to answer who can't see it is basically law enforcement, prosecutorial officials, licensing boards, regulatory boards, both state, local, federal, are not allowed to see this information in the Missouri PDMP. There is one exception, pardon me, and that is related to when the request is allowable under HIPAA. And don't really have much more information on that, but any of those types of requests would be scrutinized by our legal staff in the Office of Administration before we would be able to release anything on those grounds. I mentioned earlier that some users are going to lose access. The rule that we have in place lists the users that will be able to maintain access and be registered in the system. The rule again is 1 CSR 60-1.010. It's registration for prescription drug monitoring program. Prescribers and dispensers include the following, and that's advanced practice registered nurse, assistant physician, dentist, optometrist, pharmacist, physician, physician assistant, and podiatrist. Other healthcare providers include delegates, and the delegates include the dental hygienist, licensed practical nurse, medical assistant, medical intern, medical resident, pharmacy intern, pharmacy technician, and registered nurse. So that language can be found again on our website. I don't think I've mentioned our actual website. A lot of this information on the statute and the rule is posted on our website, and that website is pdmp.mo.gov. And a lot of good information there. Frequently asked questions and things are posted there too. Also, the user guide for pharmacies that are going to be submitting information to the statewide system. Interstate data sharing is a big concern, and it's something that is not allowed through the Missouri statute. There's several things I've mentioned already. It's not allowed. They're kind of language related throughout. The statute, again, is in this state, is used frequently. And then the biggest couple reasons is definitions used in 195-600. The definition for a healthcare provider is defined in 376.1350 of the revised statutes. And when you go to 376.135, parens 20, it defines a healthcare provider or provider as a healthcare professional or a facility. If you look at, which really doesn't give you much information, if you look at 376.1350, parens 19, that defines a healthcare professional as a physician or healthcare practitioner licensed, accredited, or certified by the state of Missouri to perform specified services consistent with state law. So that is kind of where we get the need for a Missouri license to be able to see the information in the state of Missouri's PDMP. Another issue with the statutory language is related to who we can share the information with. And that information or that piece is found in 195.600.8 parens 2. And that talks about how the state of Missouri can share information with any health information exchange that requests PDMP information, as long as it's operating in the state of Missouri. In order for PDMPs to share information with other states, there are two hubs that are used to allow this connection, to allow this exchange of data. The two hubs, one is called PMP Interconnect, the other is called RX Check. When our legal team looked at the idea of interstate sharing, and it also plays a role, as we found out, in grant writing, when we looked at that information related to RX Check and PMPI and the ability to connect and share data through them, it was determined that neither one of the two hubs used for interstate sharing meet or fit the statutory definition of a health information exchange in our statute. So that's yet another reason why we are unable to share with other states the information from the state of Missouri. We're looking at alternatives. If there's an alternative way to allow this to happen, we're continually looking, considering options, those types of things. But basically, we believe that there will be a requirement. About the only way to get this fixed is to have an amended statute at some time. So we will continue to look into those options and see what we can determine on that. The point, that's kind of where we are. Okay, real-time data submission is another requirement that kicks into place on January 1st of 2024. And basically what the requirement there is for data submission to the Missouri PDMP should happen when the prescription is dispensed. I've had several questions from mail order pharmacies that say, well, you know, we usually have UPS or someone pick up all of our our prescriptions that are going out at 4 o'clock. Is it okay for us just to send that information to you in at midnight? No, that would not be acceptable. Real-time submission means and is considered to be at the time of dispensing. There are several methods. If you look at, or if you've had an opportunity to look at the dispensing guide, our data submission guide that's on our site. There are several methods of transmitting the information to Bamboo, to our vendor Bamboo. But the key is that whichever method you use, it has to be submitted at the time of dispensation. So it's no longer will it be okay to hit a button or have something set up to be sent at midnight for the day's prescriptions. So it will have to be set up, and Bamboo has given me some information that I will be posting specifically to our website that will be resources for pharmacies to use to get this information in front of them, in front of their IT staff to make this happen. If you are already participating in the St. Louis County PDMP and you're already submitting information to Bamboo, then there's opportunity, there's processes in place that will allow you to make those changes now. So if you are currently participating in the St. Louis County PDMP, you can work with Bamboo to make those changes so that your submissions will be going real time. You can start working on that pretty much now. And this page is a resources, and this is specific for the real-time data submission. There will be other information like this that we will have on our website. Our website is listed there as pdmp.mo.gov. The Bamboo support, again, this piece is specific to the real-time submission of data. So there's some educational material that you can read or your IT staff may be able to read. There's a toll-free number, and then also the website for those types of things. My information for the PDMP program, you can reach us through the email that's listed there, pdmp@oa.mo.gov. And there's my contact information. You can call that number 573-526-9848. And my email is there, dean.linneman@oa.mo.gov. And I think we're ready for questions. And again, I think Tom has those.
Okay. Thanks, Dean, for the update there. We're going to move on to the questions. We're going to start with the ones that were submitted in advance, and we have quite a few of them. So we will work through those, and then we'll go to some of the ones that have been submitted through the webinar app. Okay. So let's see, Dean, we have some questions. This one's specific about how duplicate names and birthdays are handled by PDMPs.
Okay, I know Bamboo has a system for that, and it's probably important that I mention what actual informations are required to be reported on all prescriptions that are dispensed. Basically, it's the pharmacy's DEA number, the date of dispensation, and if it's a prescription, it's the following: the prescription number or other unique identifier, whether the prescription is a new or a refill, and the prescriber's DEA or national provider number. The national drug code for the drug dispensed, the quantity and dosage of the drug dispensed, and then the patient's identification number, including but not limited to any one of the following. So the patient's driver's license number, the patient's government issued ID number, or the patient's insurance card holder ID number. And then finally, the patient's name, address, and date of birth. So I'm not sure the exact process they use. They tout it as being state of the art, but they have a formula where they look at all the information that's submitted and are able to make identification of the patient that way. So if you need more specifics on the actual ins and outs of that, I can try to get you more information.
We have someone asking, once it's fully implemented, is there a requirement for prescribers to check the PDMP before prescribing?
That's the best way to answer that is yes and no. In the state of Missouri, the PDMP law 195-600 does not require any provider to check the PDMP. There's actually no requirement for a provider to register with the PDMP in the state of Missouri under 195-600. However, I say that, and if there's anyone on the line from MoHealthNet, they will know and understand that there are federal mandates that require physicians, providers, prescribers to check a PDMP when they're doing something. And that's based on the Support Act, and it requires the checking of the PDMP prior to prescribing a controlled substance to a Missouri HealthNet participant. I know there's information on MoHealthNet's site about the Support Act also. So if you have any questions about that, you may be able to find that information there.
This one, you probably answered again, they're clarifying, will non-participating counties in the St. Louis program be included in the new one?
Yeah, with the statewide program going active, the county piece is disappearing. It's state law, December 13th, and all pharmacies, all dispensers that dispense Schedule 2, 3, or 4 controlled substances are required to report. So yes, will be statewide.
You answered the first part. They want to know about out-of-state pharmacies if they're required to report, but they're also asking about drug wholesalers and manufacturers. Will they have any reporting responsibilities?
Right. Wholesalers are exempt from the definition in the statute of a dispenser. And I don't believe manufacturers would meet that either, as I'm not aware of manufacturers dispensing to a patient. So basically the answer is no, they're excluded. And that's from 195-600 parens 2 parens C as in cat.
Yeah, just someone online asked if we could provide some of the citations
Sure.
you read off. And I think the easiest way to do that is sometime after the webinar today, I will send out an email to everyone who's on the webinar, and I can give links to the sites that you provided today. Let's see. Will providers that work across state lines have a Missouri state license be able to use the Missouri PDMP?
Yes, and that's the Missouri PDMP is available to licensed in Missouri providers while they're providing healthcare to their patients.
Will there be a grace period to support real-time reporting?
No. Real-time reporting begins on January 1st, 24. There's nothing really written into the statute allowing a grace period. There is an opportunity for the Joint Oversight Task Force to create a rule for those unforeseen circumstances. So at this point, no rule has been created for those such instances.
Why did Missouri remove the option for a delegate to be utilized to assist in the review process?
And again, I think I kind of touched on this earlier, and I think a lot of the miscommunication came from the unlicensed comment of those individuals losing access. There still are delegates, maybe just a little different from the St. Louis County system, but there are still delegates available in the statewide PDMP. And again, that list will include dental hygienists, CMAs, RMAs, RNs, LPNs, pharmacy interns and pharmacy techs, medical interns, and medical residents.
You mentioned in your program about the possibility in the future of maybe interstate data sharing. Do you have any timeline for that?
No timeline at this point. We have information available. We've provided information to some organizations who are definitely interested in changing our statute, but we really don't have any ETA for interstate sharing due to the fact that it will require, we believe, a statutory amendment.
We currently submit to the St. Louis PDMP. Do we need to change anything when the statewide PDMP goes live?
No, basically, if you're currently submitting to the St. Louis County program, there's very little for you to do. The big thing is to work with Bamboo to transition into the real-time data submission process.
Okay, here's a specific one about a specific facility. Do state of Missouri forensic inpatient Department of Mental Health facilities who discharge patients back to jails, group homes, or other Department of Health inpatient facilities need to report?
And again, that might be, there's a lot of information in there, a lot of possibilities in there. So 195-600, 1 parens 2, again, defines this dispenser and excludes hospitals as defined in 197.020. and practitioners who administer the substance or wholesale distributors. So if an inpatient facility is considered a hospital, and we'd have to do a little more research on that, then they would be exempt from reporting. But this one, again, there's just enough information in there. I'm not familiar with all the licensing types for Department of Mental Health facilities. So whoever sent this question in, if you can give me some more information on that, we will try to get you a much better answer.
And you could send that to the email that we had on a previous slide, that either one of those would go to Dean's department. But more questions on out-of-state pharmacies required to report. Can you again go over what out-of-state pharmacies, if any, have to report?
Right, and the simple answer is out-of-state pharmacies don't have to report. The PDMP statute only requires dispensers in this state to report dispensation information for Schedule 2, 3, or 4 controlled substances.
We got a lot of questions in advance about sharing with interstate. You've already talked about that, so I'm going to skip over those since we pretty much covered that multiple times. More questions on real-time reporting, waivers, any exemptions. Are there any exemptions to real-time reporting?
Not at this point. Real-time reporting becomes the law on January 1st, 24, and there's really no exceptions, no exemptions at this time. We suggest, or I suggest you reach out, have your vendor reach out to Bamboo for support. The real-time reporting will be the second state in the country to require real-time reporting, the other being Oklahoma. So if your vendor is connected in any way to Oklahoma, I would say it would be a very similar approach to data submission, data transmission to the state of Missouri as to Oklahoma's. That's kind of from a non-technical, technical perspective.
So this question has to do with social security number. And I don't remember if that was on your list of what has to be reported.
A social security number is in that patient's identification number, including but not limited to any one of the following. So social security number is one option. A patient's government issued identification number, it's not the only option for that specific question.
And they go on to say they service Amish population who do not have that. What happens if you have someone that doesn't have one of those three options?
Then I would say that would be something we would have to investigate. That's the statute gives those three options, and we think that should cover majority, if not all cases, but those are the options available through the statute.
We did get a couple of questions in advance about what has the current PDMP in Missouri shown the data. Has there been a decrease in opioid use and overdoses on when I assume they're talking about the St. Louis County?
Right, yeah, I really do not have any access. There's no really statewide Missouri PDMP information to review. This may be something that St. Louis County could answer for you. Just in general, I believe by attending meetings, reading publications and those types of things, that we are seeing a decrease in the use of opioids, but I really have nothing, because I really have no Missouri PDMP information to support it because it doesn't exist at this point. So I really don't have anything specific on that question. But St. Louis County could be able to give you some information, or possibly even the Department of Health and Senior Services here in Jeff City may have that information after working with St. Louis County.
Here's a question about a specific practice site wanting to know about outpatient infusion centers when controlled substances are dispensed for immediate use at that facility, at that outpatient facility.
That's another one where I really think I'm probably going to need a little more information, and I have taken this piece to our legal to be able to provide a better answer. I just haven't got any information back on that yet.
I forgot to go to this slide earlier. If you do have a question for us, you can go to your toolbar and submit it there. And then I'm going to back up to the slide with Dean's, the information there, resources that has the email if you do need to email Dean more specific information. And then it also has Bamboo's info on there.
And again, on that piece of Bamboo support information, that is specifically for real-time submission of data.
I had a couple questions on zero reporting. Is there a requirement if you do not dispense controlled substance to do a zero report?
No, that's kind of goes away with the presence of real-time reporting. So zero reports are not going to be required in the state of Missouri.
I'm going to skip over some of these you definitely answered during the presentation today. Are dispensing physicians and clinics required to submit?
Yes, if they meet the definitions in 195.600. So basically, if a physician is stocking and dispensing, yes.
Okay, so you've answered the question about out-of-state pharmacies that dispense into Missouri do not have to report, but what about in-state pharmacies that are dispensing to out-of-state patients?
And yes, the answer to that is going to be yes. The language used throughout is dispensations in this state. So if you are an in-state pharmacy that is dispensing to out-of-state patients, you will be required to report that to the Missouri PDMP.
Who is funding the state PDMP?
At this point, it's 100% legislature based. It's allocated funds for the PDMP. There are always options for reaching out, requesting a grant, going for grants. And that again goes to, we were awarded a grant for $1.4 million that we were not allowed to accept because one of the stipulations in the grant required us to have interstate sharing ability with other states. So we met 52 of the 53 stipulations in the grant, but that one little stumbling block, interstate sharing, did not allow us to accept that award.
Someone's asking about have you promulgated any rules, and you addressed that. And again, I will send out an email with links to the rules and the statutes Dean has mentioned today.
Okay, and the rule was promulgated, I think it became effective in August of this year. And a little surprised there were no comments when it went through the promulgation process, but we've identified a little cleanup that might need to be, some clarity could be added to the rule. So we're working on that now.
And just to clarify, there's just been one rule?
One rule.
Okay.
Correct.
Are there any types of waivers to the reporting requirement?
No waivers.
Okay. I think you answered this. Does a hospital have to report when they discharge a patient?
I'm not really sure of all hospital requirements, but there's no discharge reporting by hospitals required to be reported to the PDMP, so no.
Someone's asking for you to explain the exemption for hospice patients.
That's pretty easy to explain, and I wish I had more information, but that is how the statute's written. It was written into the law by the statute or by the legislature. I just really have no other information on that.
And then here's another question going back to the stat. Why are Schedule 5s not required?
And that's, again, kind of similar to the hospice. Why is it included? Why is it not included? Schedule 5s, again, the legislature decided that Schedule 5s should not be reported. And I don't know the exact number, but I do know not every state requires Schedule 5 to be submitted to their PDMP. So I will put that up or chalk that up to legislative choice.
And just to clarify, there are some states that require some non-scheduled drugs to report. Missouri does not have that, correct?
Right. We have no drugs of interest reporting. There's naloxone is tracked by several state PDMPs. We do not have the authority to track naloxone dispensation. So yeah, it's Schedule 2, 3, or 4 controlled substances.
How will compliance with the PDMP be monitored or enforced?
Be monitored through the system, and there are penalties in the statute for those who access inappropriately, those who fail to submit data to the system, and those who use the information from the PDMP inappropriately. Purposely and inappropriately, I believe, is the specific language. So there will be monitoring of the system for that type of activity.
So here's specific to compounders. Are compounded prescriptions that contain controlled substances required to be reported?
Yes.
Question more specifically on the terminally ill hospice, when it comes to where the prescriptions are delivered to a facility or picked up by a nurse versus like a hospice patient at home, does that exemption apply across the board?
Yes, I believe it does. The hospice patients are exempted, again, in the definition of patient in 195-600, which states not including a hospice patient enrolled in a Medicare certified hospice program who has controlled substances dispensed to him or her by such hospice program. So we believe that exempts those hospice patients.
We have a question about manually reporting. It says, are pharmacies required to utilize real-time feature in PDMP clearinghouse, or would they be acceptable to manually report at the time of dispensing?
And again, we are developing, it may not be as clear, and it may just be the terminology used. It's a little difficult to describe, but we are developing a one-pager that should be up on our webpage by end of business tomorrow to give a little more support for that real-time conversation. But the method of reporting is up to the pharmacy. The big in bold reminder is you can report it any way you like as long as it's done at the time of dispensation. So the method of reporting needs to be done in real time at the time of dispensation. And again, we're trying to provide some clarifying data information on our website for that piece.
Yeah, we had a lot of questions about waivers. You pretty much said there aren't any, so we're going to skip over those. More questions. I have a lot of questions on real-time reporting versus data at the close of business reporting. I think you've touched on that already.
Mm-hmm.
Can you explain integration with the new PDMP and electronic health records?
Sure. St. Louis County has many health systems already integrated and pharmacy systems integrated with the Bamboo system. The plan as part of the sharing agreement is for a very short period on the wee hours, late morning hours of December 13th, we'll have to disable those integrations and bring them back up as we transfer from the St. Louis County program to the state program. We are expecting a very short time frame, very little interruption in those integrations, and plan on that, approaching it that for those who have integrations at this point. After December 13th, we will have an opportunity, Bamboo will have another piece of information where it will be loaded to our site where individuals, hospitals, pharmacies can request integration, and we will move forward with those who do not have integration at this point after the December 13th go live date.
Asking about how to get in touch with someone at the OA PDMP program with account registration questions. What's on the screen right now would be the answer for that.
Yes, that would work.
And then they want to know, is there expected time to hear back?
It's as soon as possible. I hate a overloaded inbox, and if the program doesn't have an answer, we'll let you know we don't have an answer and we're working on it. It may take a little bit longer, But the plan is to respond with information or respond with, we'll be getting back to you as soon as we can. So that's kind of how we're going. There's 30 minutes, an hour, not defined, not really going to be possible to do that at this point. But if you have any issues with Bamboo, reaching out to Bamboo and not getting the support that you need in a timely fashion, the PDMP staff needs to know that as well, so we can enforce some of the contractual obligations they have with us.
This inquirer had some other questions that I think would probably be best just if they could send them directly to you on, would be the appropriate way to get those answered. Let's switch over now and take we got a few minutes left. We can try to take some of the questions that came in. We have a lot of them. So I can tell you right now, we will not get to all of them. And if we don't, again, you can send your questions directly to Dean at either one of the email addresses he mentioned today. Again, more questions on a grace period. Dean has already answered that. Someone wants to know about return to stock prescriptions when something's returned to stock. So they want to know how will that be updated?
That should be, I believe it should be in the dispenser manual, but it sounds like a voided transaction that will need to be documented in the system to correct for that issue.
When someone's asking, is it possible to get a list of the counties or municipalities that did not agree to share?
Yeah, and what at this point, I had a conversation with Bamboo in St. Louis County right before this call. We have one county at this point that has indicated they may not be agreeing to share the data, and I don't want to blow them away or anything like that, but it's one county, and we'll see if we can share that information. But basically, any county that doesn't provide the St. Louis County PDMP the go-ahead to share their data, that county's data is not going to be available, and those practitioners will have to re-register. So they'll be starting from scratch, but they will still have access to all the other information throughout the state.
So that person could email you directly.
Correct.
And you could let them know.
Yep.
Okay. A person asking about methadone clinics, would they be required to report?
Are they dispensing? Again, that might need just a little more information. Send that to me and we'll review it a little more thoroughly. Again, basically the exceptions in the statute for dispensing are hospitals, practitioners or other authorized person who administers a substance, and wholesale distributors. So again, it doesn't hurt to have a little more information before I respond.
We got a couple of people asking about providers at the VA. How will they be able to access?
Yeah, I've had a busy day today. I've talked with Bamboo and I've talked to the VA. And again, one of the documents we released was a little narrow focused, state of Missouri statutorily focused. And there was an oversight on the Mission Act. The Mission Act is a federal act that requires state PDMPs to allow access to VA prescribers and delegates in any state. So we are reviewing that and making the change so that those VA providers and delegates that were in the St. Louis County system will, on December 13th, retain their status in the state of Missouri. There's a couple other little pieces having to go through that, and some of that is related to how people were classified when they registered with the St. Louis County program. So we're reviewing all those things. We definitely do not want to have individuals who should have access not have access when we flip over to the statewide program.
For a hospital that in addition to doing discharge for patients, they also fill outpatient prescriptions for their employees, do they have to report those dispensing?
Again, that's specifics. We'll look into, again, more information. It may depend on how that hospital is licensed. If that piece, the pharmacy is within the license, not within the license as an outpatient pharmacy, there's a lot of little details there. So if you want to send me more specifics on that, we can definitely get you an answer.
In the event of an error, is there a way to request the change to data that was already submitted?
There is. There's error correction process in the data submission guide.
Can a patient request information out of the P for them?
Yes, a patient can request their own information, absolutely.
Okay.
And also related to that, prescribers can request their prescription history. So that, and we actually encourage that, or I understand other states encourage that, because sometimes the prescribers themselves will be able to identify prescriptions they did not write. So they may be able to catch some fraud.
Do you have to be licensed in Missouri in order to access the PDMP?
Yes, that's basically one of the requirements for a healthcare provider that's listed in the statute. You have to do a little bit of looking into statutory language to get to that, but that is a requirement. With the provision may be different for VA providers.
Someone's asking about repeating the information you said about non-certified pharmacy technicians. I'm not remember you saying anything about certification as a requirement.
No, it's those medical assistants. The CMAs and the RMAs will be available or will be allowed access to the PDMP. It's pharmacy interns and pharmacy techs will still be able to be delegates in the statewide system.
So a technician does not have to be a certified pharmacy technician in order, as long as they hold a license with the board, they're good to go. Okay.
Correct.
Well, we are about out of time. We have lots of questions still here pending. I would recommend sending them to Dean at the email address on the screen there. And again, I will send out an email to all the participants today with the law citations and a link to them, and then Dean's contact information too. So again, we do record our webinars. You can find them on our website. We do have all the past ones, including the 5 we've done so far in 2023 on there if you want to watch any of those. To get CE for today's program, you must complete the post survey that comes at the end. So after I announce that I'm closing the webinar, there's a little window will pop up. Do not close your browser and click close. And then again, keep your browser open and the survey will open on your screen. Answer the 5 questions and click submit. Should you not get the questions, you can always email us at compliance@pr.mo.gov. We will email you the questions. You must have your answers back to us within 24 hours in order to receive CE credit. We will email certificates in approximately 30 days. Save your certificates because the board does not submit to the CPE monitor. I want to thank Dean for coming today to give us a lot of information on the upcoming PDMP program.
Thank you for having me.
And I'm now going to close the webinar.